Hello, my name is Lori Drabble, and I'm a professor in the School of Social Work at San Jose State University. This presentation will review some of the key definitions and core ideas associated with community-engaged or community-partnered research. This learning module will cover several learning objectives. First, it will advance understanding of some of the core characteristics of community-engaged research, will help explain some of the differences between community-engaged and traditional models of research, explore some of the benefits that may arise as a result of research that is based in community perspectives and community voices, and describe some highlights from recent community-engaged research projects. Community can be defined as a group of people who are linked by social ties, sharing common perspectives or interests, who may or may not share a geographic location like a county or a city or a specific local community. Communities does not refer only to geography, but also as shared identity, such as a cultural or ethnic identity, being part of a lesbian, gay, bisexual, and transgender community, being part of a support network for recovery from alcohol or drug dependence, and so forth. So community may be defined differently in different projects. A community might include clients and consumers of different agencies or service delivery systems. Your community may include policymakers, clinicians, and community agency staff, or neighborhoods and advocates. Regardless of how community is defined for any given project, it's important to remember that members of a community have some meaningful characteristics in common. At the same time, communities are not homogeneous, and they may not speak in one voice. So it's important to consider inclusion of community members who may have different perspectives and different experiences. In this module, the term community is used to mean groups outside of academia. Researchers conducting community-engaged research will work with community leaders, community organizations, and agencies, and community members. These groups represent different facets of a community and are likely to have different perspectives. This definition was developed by the Center for Disease Control and Prevention. And this is a very helpful definition of community engagement. Community engagement is the process of working collaboratively with groups of people who are affiliated by geographic proximity, special interests, or similar situations with respect to issues affecting their well-being. Now that we've defined community engagement, the question is, what is community-engaged research? Community-engaged research addresses community concerns. It's critical that the community identify their own issues and concerns upon which the research is focused. When we think of who develops research questions in traditional research, it's often largely based on the needs or the queries of the researcher. Community-engaged research prioritizes the interest and needs of the community, assuming that community members are best able to recognize and address social issues that impact their community. Community-engaged research also builds on the strengths and knowledge that already exist in the community. This model builds on community strengths and knowledge. The researcher shares their expertise and works with community members so that both the community and the researcher may build on their respective existing strengths. It also presumes that there are strengths located in both academia and in the community. Community-engaged research requires the development of partnerships with communities. The level of partnership might range from simple cooperation to full collaboration. This type of work necessitates partnerships. It's not run by the researcher. Levels of collaboration, again, can range from cooperation to collaboration. In the first instance, the community, for example, might identify the main problem and then would allow the researcher to follow up with assessment, planning, and/or implementation of the research. Alternatively, full-fledged collaboration might occur in which community members are equal partners in all phases of planning, research implementation, dissemination of findings, and recommendations about how to respond to or institutionalize the findings. Also, you might find different terms when referring to community-engaged research. Sometimes people refer to community-based research or community-partnered research. You may also hear terms used for different types of community-engaged research, such as participatory action research, which is a specific type of research directed toward advancing social change, and community-based participatory research, which is a specific type of community-engaged research that involves full participation of community partners. So, community-engaged research is a framework or approach for conducting research. It is not a methodology. Any methodology might be used in conjunction with this framework. Community-engaged research requires partnership development, cooperation and negotiation, and a commitment to addressing local health and social issues. And community-engaged research exists on a continuum with variations in the level of community academic collaboration, but it always involves the community in a meaningful way. So, one of the things that is important to highlight for students or for researchers who may be familiar with traditional research is a contrast between traditional research and community-engaged or community-partnered research. This slide is a side-by-side comparison of traditional community-engaged and specifically community-based participatory research based on a source provided at the bottom of this slide. So in general, in traditional research, the responsibility and the control is located with the researcher. So the researcher or the research team defines the research question and controls all the phases of the data collection, analysis, and dissemination of the research findings. In this model, people in the community, whether they're individuals and families in the local community, clients in an agency, or professionals, are the subjects of research. In traditional research, these community members are really just subjects of research who provide data, but aren't really part of the planning or implementation, and often don't even find out about the results of the research because findings are frequently published in peer-reviewed journals that often are not very accessible to communities. By contrast, community-engaged research means that the community, however that community is defined for a given project, is involved in all stages of the research project. The level of involvement of the community partners might vary depending on the purpose of the research project and the preferences of the partners. However, in community-engaged research, the respective roles of the researcher and the community are negotiated in advance. In community-engaged or community-partnered research, people are participants and collaborators, not just subjects of research. There are explicit agreements about how data is shared, how findings will be disseminated, and in general, there's also consideration of building the strengths and capacities of partners. So why do you think it's important to do this kind of research? There are a number of important answers to this question. Why do it? Well, first of all, collaboration is essential to solving complex social problems. Complex social problems such as those related to child welfare, domestic violence, working with trauma across systems, when we know that families and individuals in systems are often trauma survivors, can only be addressed with involvement of multiple stakeholders. Ultimately, the purpose of collaborative research and practice is to improve outcomes and affect change. Considering the community as an expert creates the opportunity to explore and understand issues in a different light and invites options for research that may have been otherwise undiscovered. One of the advantages is that it builds relationships between community and researchers. Relationships may include those built between the researcher and the community, between different organizations, between members of the community themselves, and more. Community-engaged research also supports institutional change. A primary goal of community-engaged research is to support structural change and systems improvement through building and supporting organizations and adding resources to the community. This is distinct from some traditional forms of research which place greater emphasis on contributing to professional knowledge through publication and scholarly literature. Although community-engaged research may also be published, there is an equal emphasis on providing feedback that is useful for community partners. Finally, it maximizes learning for distinct stakeholders: students, community, faculty. Community members who are placed in the role of subjects of research may be accustomed to having things done for them or done to them. Community engagement in the research process aims to build learning opportunities at every step for involved community members. It also affords opportunities for students to learn research skills in a way that's directly connected to agency practice or community concerns. If you're interested in other information, we've provided a few resources on this slide. Some of these resources inform this presentation and, again, in general, provide additional specific information for those of you who would like to delve further into community-engaged and community-partnered research. This presentation was produced in part with the Child Welfare Partnership for Research and Training, a project of the SJSU School of Social Work. The CW part was developed with support of the California Social Work Education Center, or CALSWEC. The content of this presentation are those of the contributors and don't necessarily represent the official position or policies of CALSWEC. If you want more information about the CW part, we have some contacts here. And although this was focused on the CW part in terms of some of the examples, the overall design of partnered research is relevant to many other team and individual projects that we conduct as part of the School of Social Work research in communities. Thank you for your attention, and we wish you the best in your partnered research endeavors.